Kia ora tātou, my name is Maria and this is my oral video presentation for Healthcare Social Science. I have decided to choose case scenario number 1, who is Mrs. Chen. I'm just going to do a brief summary of who Mrs. Chen is. Mrs. Chen is a 48-year-old female who has been getting headaches/migraines for the last 3 years, and 18 months ago she was prescribed medication called Rizamount, and the side effects for Rizamount would be some dizziness, some drowsiness, and a little bit lightheadedness for some people. So she's been taking that for the last 18 months. And she also works full-time as a recruitment agent, 40 hours a week, which she is very busy at work. And also once a month she enjoys being outdoors in nature and also with her friends. She loves to go out to these trail walks and to do some hiking as well. She tries to complete each hiking trail from the month before, and she's been doing that once a month, and apparently she's been really doing these trails with her friends, so she's been feeling a bit down. 3 weeks ago she had an accident. She tripped over when she went hiking and she rolled over her right ankle, which is unfortunate for Mrs. Chen. Okay, so that's just a brief summary on Mrs. Chen. So I'm just going to go through the questions. So question number 1 is, identify with dysfunction, one physical and psychological dimension within each sports athlete scenario. So question number 1 for psychological dimension I chose for Mrs. Chen was anxiety. So Mrs. Chen suffers from anxiety since she's had the accident. She's been unable to walk and she's feeling discomfort since the accident 3 weeks ago. So she's a little bit anxious to walk long distances, and she's really worried about when she can return to her hiking, which she really enjoys doing. So she's a little bit worried about that. So yeah, definitely psychological dimension is anxiety. And for physical dimension, I chose minor soft tissue strain to her perineal muscles, and they're still in the acute stage. So that's a definitely acute injury that she's had from her accident while she was going hiking. So her perineal muscles would be her anterior part of her ankle, and also the lateral compartment of her lower leg on her right leg. And question number 2, predict how the signs and symptoms of the physical and psychological dimensions may present in a clinic setting. So Mrs. Chen, I chose for anxiety, the symptoms would, so the signs would be shortness of breath, so feeling tension, she's a little bit feeling nervous, at times you can feel overwhelmed, so that would be a symptom from her shortness of breaths. Increasing heart rate, that's a symptom of shortness of breath as well. Some tension, nervous, sweating is actually another sign. And also she could be worrying a lot. She could be having racing thoughts in her mind a lot. So yeah, a little bit of anxiety there. And when it comes to her injury, her physical injury, it would be because it's in the acute stage, so definitely still some swelling in her right ankle, still feeling some pain in her ankle area, in her right ankle, limited range of motion, probably not able to do plantar flex or dorsiflex with her ankle, because she's rolled onto maybe her lateral side of her ankle. Maybe some inversion and eversion as well, and supination and pronation of her foot. Also, there will still be some heat in the acute stage, some redness as well. There would be some joint instability of her ankle joint. So yeah, because it would be in pain, the swelling could be a barrier for her to actually do her range of motion movements. And also it would definitely affect her gait when she's trying to walk on her injured ankle as well. So that's question number 2. So question number 3 is examine any red flags and or contraindications that may be present in the sports athlete scenario. So for Mrs. Chen, red flags and or contraindications, definitely her injury, because she's still in the acute stage, which happened 3 weeks ago, and it still shows that she's been diagnosed from the x-ray a minor soft tissue strain to her perineal muscles. So that's definitely a contraindication for a massage. Definitely wouldn't touch that area, not deep tissue or any type of massage around that area of an injury. And she's definitely not ready for a massage for at least another month's time, she's been told. And for her anxiety, it would be a contraindication, because she's a little bit worried. She could still have some fear avoidance to do with her ankle, with the injury of her ankle. And also she's wanting to get back to her monthly trail walks and hikes with her friends. That's just something for her to enjoy, so she's wanting to get back to that. But yeah, probably she'd still be able to do some relaxation massage if she's wanting, but definitely do not avoid the injured area as well. So question number 4 was just find the modification you may need to make to the massage session in regards to sports athletes presenting condition. So modifications for Mrs. Chen, definitely like avoid the injured area, the right ankle. I would probably sort of modify the use of language, maybe be positive, nurturing, sort of be a little bit empathetic because of her injury and because of her anxiety. Be positive, use positive language. So with home care, I would definitely get her to do, maybe ask her if she would like to learn how to do some breathing techniques to sort of help her anxiety so she can feel a bit more calmer and relaxed. Breathing techniques would be like breathing from the deep breaths from the lower abdominal area instead of like from the upper chest area. Probably suggest some muscle progression relaxation techniques. It's really good with some meditation music if she's into that kind of thing. She's wanting to do that, or she's got a bathtub. I'd probably suggest take a bath with some Epsom salts and a bit of apple cider vinegar. And maybe take some, definitely because she's working 40 hours a week, take regular breaks. She needs to, because obviously with her injured right ankle, she won't be able to move as much because she has a limited range of motion. So she definitely wouldn't be able to move around if she's working. So that would affect, because she needs to sort of rest, keep off her ankle at work. So maybe they can probably change her workstation, or maybe she can work from home, who knows. So yeah, those are my 4 questions to do with Mrs. Chen, and hope you enjoyed my presentation. And yeah, so Paul Maria, good night.